You want to get a real handle on something, but without wading through tons of technical stuff or like spending forever trying to figure out the jargon, right?
Uh-huh.
That's exactly what we aim for here on the deep dive. So today, we're tackling a health issue that, honestly, a lot of pet owners might run into.
Yeah.
Chronic gastritis in dogs and cats.
Yeah, we've sifted through the medical literature and background info to really pull out the key things you need to know about this condition.
Exactly. We're going to look at, what's actually going on inside your pet's stomach with chronic gastritis,
Hmm.
what signs you should be looking out for, the potential causes behind it, and then how your vet goes about diagnosing it and hopefully getting them feeling better.
Right.
Think of this as getting that core understanding, but without needing a medical dictionary handy.
And one really important point to sort of establish right away is that we're talking about vomiting that's been happening intermittently, on and off, for more than just a week or two.
Okay, so not just a one-off tummy upset?
Precisely. Also, while that stomach irritation can lead to things like erosions or ulcers, little sores, whether those actually develop really depends on what's causing the gastritis in the first place and, how long it's been going on.
Got it. Okay, so let's dive in. What is actually happening physiologically when a dog or a cat has chronic gastritis? What's the basic mechanism?
Well, at its core, it's really about long-term irritation of the stomach lining, just constant annoyance, essentially.
Okay.
And this ongoing irritation triggers an inflammatory response from the body. The interesting part is just how many different things can cause that irritation. We're talking about maybe obvious things like chemical irritants if they lick something they shouldn't, or drugs, swallowing foreign objects,
Stuff they eat, yeah.
right? Or even just ongoing problems with too much stomach acid hyperacidity.
Those seem like the kind of usual suspects. But the sources mentioned some less obvious triggers too, didn't they?
Oh, absolutely. We also have to think about things like chronic exposure to an allergen, maybe something in their food that they react to over time.
Ah, like a food allergy building up.
Exactly. And then there are immune-mediated diseases. That's where the pet's own immune system gets confused, essentially, and starts attacking the cells of the stomach lining by mistake.
Wow.
And this inflammation, it's not always just superficial. It can actually extend deeper into the stomach wall tissues.
And I guess all that chronic upset, the vomiting itself, that can cause knock-on effects, can't it?
It definitely can. Frequent vomiting can really irritate the esophagus, the tube leading down to the stomach. That irritation and inflammation is called esophagitis.
Okay.
And then much less common, thankfully, but more serious, is a risk of aspiration pneumonia. That's where some stomach contents are accidentally inhaled into the lungs.
Oof.
Yeah, it's more of a worry if there are already other problems with the esophagus or if the pet is generally quite weak or debilitated.
So it really sounds like a potential cascade of issues, all stemming from that initial stomach lining irritation.
Right. Now, who tends to get this? Is it like equal opportunity across all dogs and cats? Well, chronic gastritis is actually relatively common overall in both species, but we do see some interesting predispositions.
Okay.
For example, in dogs, certain older small breeds, think Lhasa Apsos, Shih Tzus, miniature poodles, they seem more prone to developing a specific type where the lower part of the stomach lining thickens up. It's called antral mucosal hyperplasia or hypertrophy.
Huh. Any idea why those smaller, older dogs?
It's not always crystal clear, but genetics likely play a part, maybe influencing how their stomach tissue reacts to irritation or just predisposing them to those specific kinds of changes over time.
Right, predispositions pop up everywhere in vet med.
They really do. You also have breeds like the Norwegian Lundehund, which
Yeah.
is more susceptible to chronic atrophic gastritis, where the stomach lining actually thins out over time.
The opposite problem.
Kind of, yeah. And then Basenji's and Drent's petraceans can be more prone to chronic hypertrophic gastritis, where the lining gets really thick. But, it's important to remember the average age of onset and whether males or females are more affected. That can really vary quite a bit depending on the specific underlying cause.
Okay, that makes sense. So we have a picture of what's going on inside and who might be sort of more at risk. What about the signs? What are the key things an owner might actually see at home that should raise a red flag?
Yeah, the history, what you observe is often the starting point, and you should really pay attention to the vomit itself.
Okay.
Often it's bile stained, that gives it that yellowish or greenish color. That happens because bile, which normally hangs out in the small intestine, backs up into the stomach because of all the irritation and maybe altered motility.
Right, that backwash effect.
Exactly. You might also see undigested food in there, obviously. Sometimes you might notice little flecks of fresh blood. Or, and this is a key one, the vomit might look like coffee grounds.
Coffee grounds. Okay, that's a memorable, if not very nice, description. So not bright red, but digested blood.
Precisely. It's blood that's been sitting in the stomach acid for a bit.
Okay.
The frequency of vomiting is also really important. It might start off, maybe just once every few weeks, but the tendency is often for it to become more frequent over time, maybe eventually happening daily or multiple times a day. You might also notice that eating or even just drinking water seems to trigger an episode.
And I've heard people mention vomiting first thing in the morning before breakfast. Is that significant?
It can be, yes. That early morning vomiting, often just bile, can be a sign of something called bilious vomiting syndrome, which is related to that reflex of bile into an empty stomach overnight.
Gotcha.
Other things to watch for? Well, weight loss can happen, especially if they have a poor appetite for a long time because they feel nauseous.
Makes sense.
And while melena, that dark, tarry stool, which indicates digested blood from higher up, can happen with ulcers, it's actually not super common with just chronic gastritis itself unless there's significant ulceration.
Okay.
Some pets might also drink more water than usual, and if the inflammation extends into the intestines as well, which sometimes happens, you might see diarrhea alongside the vomiting.
So quite a few clues potentially there for an owner to pick up on. What about when they get to the vet? Does the vet usually find obvious signs on the physical exam?
It's interesting. A lot of the time, the physical exam might actually be completely normal.
Really?
Yeah. Now, if the pet has been anorexic and losing weight for a while, the vet might notice they're, a bit thin. And if there's been some chronic low-grade blood loss causing anemia, their gums might look a bit pale, but obvious pain when the vet presses on their belly. That's actually rarely noted specifically with chronic gastritis.
Okay, so what the owner reports seeing at home sounds absolutely critical then for the vet to start piecing things together. Right, let's get to the really big question then.
Yeah.
The why. What are all the potential things that could be causing this ongoing stomach upset?
Yeah. This is where it gets complex because the list is pretty long. We can try to group them, though.
Okay.
First, you have inflammatory causes. This umbrella includes things like immune-mediated reactions we mentioned, dietary allergies or intolerances, and then, frankly, cases where we just can't find a specific trigger. That's what we call idiopathic.
Idiopathic, the classic, we're not sure yet, diagnosis.
Pretty much. Then there's dietary indiscretion, pets eating things they shouldn't, plant material, foreign objects, chemical irritants.
Creating the trash, eating grass.
Exactly. Toxins are another category, things like fertilizers, herbicides, cleaning agents, maybe even heavy metals. Then systemic diseases can manifest with stomach signs. Think metabolic or endocrine issues like kidney disease causing uremia, chronic liver disease, hypoadrenocorticism, that's Addison's disease, or even pancreatitis.
Wow, okay, that's already a hefty list. What else?
Unfortunately, we also have to consider neoplasia or cancer. Some common ones affecting the stomach are gastrointestinal lymphoma, gastric adenocarcinoma. Small cell lymphoma is particularly seen in cats, but we're actually seeing a bit more of it in dogs recently, too. Less common things could be gastric polyps, which are usually benign growths, or rarer tumors like gastrinomas, leiomyosarcomas, plasma cell tumors, mast cell tumors.
Well,
Parasites can do it too. There's a stomach worm called Physoloptera that can affect both dogs and cats. And then cats specifically can get things like Oelonis tricuspis and Gnathostoma.
parasites.
Yeah.
Think of those.
Yep. And certain drugs are well-known culprits, especially NSAIDs, non-steroidal anti-inflammatories, and glucocorticoids, steroids like prednisone.
Right. Those often come with warnings about stomach upset.
They do. Infectious causes are also on the list. Helicobacter bacteria are frequently discussed, though their exact role is sometimes debated. Fungal infections like pitheosis can affect the stomach, and certain viruses like distemper in dogs or feline leukemia virus in cats can sometimes be involved. And finally, a sort of miscellaneous category includes the bilious vomiting syndrome we talked about, potentially stress-related gastritis, and even a condition called achlorhydria, where the stomach doesn't produce enough acid.
That is a truly comprehensive list. It really underscores why diagnosing this isn't always simple.
Okay, so given all those possibilities, are there specific risk factors that make a pet more likely to develop chronic gastritis?
Well, as we touched on, certain breeds seem genetically wired for specific types. But beyond genetics, Definitely taking medications like NSAIDs or steroids increases the risk.
Right.
Environmental factors are huge too. Pets that roam free or are unsupervised outdoors, they just have way more opportunity to ingest inappropriate things, toxins, foreign objects, garbage, you name it.
Makes sense. Opportunity knocks.
It does.
Yep.
And then, of course, there's the risk associated with ingesting a specific dietary component, an antigen, that triggers an allergy or intolerance, leading to that chronic inflammation. Right. So supervision, medication awareness, and potentially diet are key areas. Okay, let's shift to diagnosis. How does a vet actually figure out which of those many possibilities is the culprit? How do they put the pieces together?
Well, the very first crucial step is making sure it's actually vomiting we're dealing with and not regurgitation. They look different.
How so?
Vomiting is an active process. You see abdominal effort, heaving. Regurgitation is more passive, like the food just sort of comes back up, often undigested, shortly after eating, without much effort. Distinguishing that is key.
Okay, important distinction.
Definitely. It's also important for the vet and for you to know that other conditions can mimic chronic gastritis. Things like inflammation further down in the small intestine or even tumors in the stomach or small intestine can present with very similar signs like chronic vomiting.
So ruling things out is a big part of it.
A very big part. And often, when we've ruled out all the specific identifiable causes, infections, toxins, systemic diseases, obstructions, etc., we arrive at that diagnosis of idiopathic gastritis, basically inflammation without a known cause.
Okay.
And when we look at biopsies from these idiopathic cases under the microscope, we usually see an infiltration of inflammatory cells, most commonly lymphocytes and plasma cells. It tells us the immune system is reacting even if we don't know exactly why.
And you mentioned other types of gastritis earlier, like eosinophilic.
Right. There are less common inflammatory patterns, too, named after the predominant cell type, like eosinophilic gastritis, lots of eosinophils, or granulomatous histiocytic macrophages. There's also the atrophic thinning and hypertrophic thickening types we mentioned with certain breeds. And sometimes, honestly, the microscopic findings can be a bit mixed.
Can the vet get clues just by looking inside the stomach with a scope, an endoscope?
Absolutely. Endoscopy provides a direct view. For example, in atrophic gastritis, because the lining is thin, the vet might actually be able to see the underlying blood vessels more clearly than usual.
Ah.
And with hypertrophic gastritis, those folds inside the stomach, the rugae, look really prominent and thickened, and they don't flatten out properly when the stomach is gently inflated with air during the procedure.
So visual clues can help guide the process.
Yeah.
What about standard lab work? Blood tests, urine tests, what can they tell you?
Routine labs, a CBC, chemistry panel, and urinalysis are almost always part of the workup. Often they might be surprisingly normal, especially if it's idiopathic gastritis,
Okay.
but they're crucial for finding those other underlying diseases. For instance, if the pet is really dehydrated, the blood counts might look concentrated hemoconcentration. If there's been chronic bleeding, say from ulcers, we might see anemia. If it's been going on a long time, it might be a specific type called microcytic hypochromic anemia, suggesting iron deficiency. If it's eosinophilic gastritis, we might see elevated eosinophils on the CBC. If kidney failure is the root cause, uremic gastritis, we expect to see high kidney values, azotemia, and usually dilute urine.
Gotcha.
Liver disease might show up as changes in liver enzymes, bilirubin or albumin. Addison's disease can cause characteristic electrolyte shifts, high potassium, low sodium. And if there's an obstruction blocking food from leaving the stomach, that can cause specific patterns in electrolytes and bicarbonate levels too.
So that initial blood work is really screening for a lot of those systemic causes on our big list.
Exactly. It helps narrow things down considerably.
Are there any other, maybe more specialized lab tests that might come into play?
Sometimes. If there's a suspicion of a rare tumor called a gastrinoma, which produces excess gastrin hormone leading to severe ulcers, we can measure serum gastrin levels. High levels, especially without kidney disease, can be suggestive.
Okay, and what about imaging? X-rays, ultrasound, how do they fit in?
Imaging is often very helpful. Standard X-rays might be normal, but they can sometimes spot obvious foreign objects or show signs suggestive of a thickened stomach wall or an outflow obstruction, like a stomach that looks persistently full of gas or fluid. Contrast radiography, where the pet swallows barium or another contrast agent, can sometimes help outline things better. It might reveal foreign objects that didn't show up well before, confirm an obstruction, show delayed emptying, or highlight defects or thickening in the stomach wall.
And ultrasound.
Ultrasound ultrasound is often very useful. It gives a great view of the layers of the stomach wall, so it can detect thickening, loss of normal layering, potential ulcer craters, and sometimes identify foreign material as well. It also lets the vet examine other abdominal organs at the same time.
Right, so imaging adds more structural information.
Mhm.
But it sounds like for a definitive diagnosis of the type of gastritis, you really need to look at the tissue itself.
That's usually the case, yes. Gastroscopy, putting that flexible camera down into the stomach, is key. It allows direct visualization of the lining, looking for redness, swelling, erosions, ulcers, masses, or changes in the folds.
And taking samples.
Crucially, yes, tiny biopsy samples are taken from the stomach lining, and ideally also from the first part of the small intestine, the duodenum, since inflammation often involves both areas.
Even if it looks normal.
Yes, absolutely. Microscopic changes can be present even when the lining looks okay to the naked eye. Those biopsy samples are then sent to a pathologist for a histopathology examination under the microscope. That's often required for the definitive diagnosis and to determine the type and severity of inflammation.
And you mentioned endoscopy can sometimes be used for treatment too.
It can. If a foreign object is seen during endoscopy, often special grasping tools can be passed through the scope to retrieve it without needing surgery.
Ah, neat. When might surgery be necessary then?
Surgery, usually an exploratory coleotomy, might be needed in specific situations. For example, if there's suspicion of a perforated ulcer, a hole right through the stomach wall, or if there's a lesion deep within the stomach wall that can't be reached, or adequately biopsied via endoscopy, surgery allows for full-thickness biopsies or potentially removing part of the stomach if needed. And of course, we shouldn't forget simpler diagnostics like fecal flotation to check for intestinal parasites.
Okay, so when the pathologist looks at those biopsy samples, what are they looking for specifically? What tells them it's, say, lymphoplasmacytic versus eosinophilic gastritis?
They're looking at the types and numbers of inflammatory cells that have infiltrated the tissue. In idiopathic lymphoplasmacytic gastritis, the most common form, they'll see increased numbers of lymphocytes and plasma cells. In eosinophilic gastritis, it's predominantly eosinophils and so on.
Makes sense.
They also look for changes to the structure of the lining itself. Are the glands damaged, overgrown, hyperplastic, or shrunken, atrophic? Is there swelling, edema, or scarring, fibrosis? They'll also look for infectious agents. If they see spiral-shaped bacteria like Helicobacter within the gastric glands, especially if there's associated inflammation like lymphofollicular gastritis, clusters of immune cells, that's significant. Special stains can help confirm Helicobacter or identify fungal organism.
And finding Helicobacter automatically means it's the cause.
Not necessarily. Its role can be complex, but finding it, especially with inflammation, often warrants treatment. Interestingly, sometimes just treating the Helicobacter resolves the clinical signs, even without needing immunosuppressive drugs.
Huh.
And if the pathologist notes significant hyperplastic changes, excessive cell growth, that might prompt the vet to recheck those gastrin levels we mentioned, just to rule out a gastrinoma, especially if antacid medications have been stopped.
So it's really detailed microscopic detective work.
Okay, let's switch gears to treatment. Once you have a diagnosis, or at least a strong working suspicion, what can be done?
Well, the immediate approach depends on how the pet is doing clinically. Most are stable enough to be managed as outpatients, maybe starting dietary trials or medications while awaiting biopsy results, for example.
But not always.
No. If a pet is severely dehydrated from vomiting, or vomiting so much they can't keep anything down, they'll likely need hospitalization for intravenous fluids, eye crystalloids, to correct dehydration and electrolyte imbalances first.
Okay, stabilize first, and I imagine diet is a huge part of managing stomach issues.
Oh, absolutely. Diet modification is often a cornerstone of treatment. The general recommendation is usually a highly digestible, low-fat food. Often we aim for something with a single, preferably novel, carbohydrate source and a single protein source.
Novel meaning something they haven't eaten before. Exactly. Think proteins like non-fat cottage cheese, boiled chicken or turkey, skinless, lean boiled hamburger, maybe even tofu. For carbs, plain cooked rice, pasta, or potato are common choices. The ratio is often something like 1 part protein to 3 parts carbohydrate.
And how you feed it matters too.
Yes, feeding small amounts frequently, say every 4 to 6 hours, or even more often, can be less taxing on an irritated stomach than 1 or 2 large meals.
Okay, what if you suspect a food allergy is the driver?
Then we'd reach for either a novel protein diet using a protein source the pet has definitely never encountered, like venison, rabbit, duck, etc., or a hydrolyzed protein diet.
Hydrolyzed.
That's where the proteins are enzymatically broken down into such tiny pieces that the immune system is much less likely to recognize and react to them.
Ah, clever.
It's really crucial, though, to feed these therapeutic diets exclusively, no treats, no table scraps for at least 2 to 3 weeks, sometimes longer, to properly assess if they're helping.
Patience is key.
Definitely. And for those pets with bilious vomiting syndrome, that early morning bile puke, sometimes giving a small meal right before bedtime can prevent the stomach from being empty for too long overnight and reduce that bile reflux.
Good tip. Okay, so diet is often step one. What about medications? What are the main drugs used?
There are several classes. If endoscopy showed erosions or ulcers, specific treatment is needed for those, typically involving acid suppressants like proton pump inhibitors or H2 blockers, and maybe stomach protectants like sucralfate. We won't dive deep into ulcer treatment here, but it's a key part if they're present.
Right.
Now, for suspected immune-mediated gastritis, where dietary changes alone aren't enough, glucocorticoids like prednisone are often the next step.
Steroids.
Yep. The dose is calculated based on weight, usually given once daily initially, and then gradually tapered down over weeks to months once signs are controlled, aiming for the lowest effective dose. There's generally a maximum recommended daily dose, even for giant breeds.
Okay. And if Helicobacter is found or strongly suspected?
Then a combination therapy is typically used, often involving antibiotics like amoxicillin and metronidazole, plus maybe bismuth subsalicylate, the active ingredient in Pepto-Bismol. This triple therapy is usually given for about 3 weeks.
What about just controlling the vomiting symptom itself?
Antiemetics are very useful, especially if the vomiting is severe or causing fluid and electrolyte problems. Meropitant is a common and effective choice.
And you mentioned drugs to help stomach emptying.
Yes, prokinetics. If delayed gastric emptying or that bile reflux seems to be part of the problem, drugs like metoclopramide, cisapride, or sometimes low-dose erythromycin can help stimulate motility. Metoclopramide can even be given as a continuous IV infusion, CRI, in hospitalized patients if needed.
Sounds like a well-stocked toolkit.
Yeah.
Are there times when certain drugs should definitely not be used?
Yes, there are contraindications. Prokinetics shouldn't be used if there's a physical gastric outflow obstruction. You don't want to push contents against a blockage.
Right, that makes sense.
And antacids or acid suppressants are generally avoided in the rare cases of atrophic gastritis associated with echlorhydria, where there's already too little stomach acid.
Okay. Any major precautions owners should know about, especially with long-term meds, like steroids?
Definitely. Steroids suppress the immune system, so pets on them are more susceptible to secondary infections. Owners need to watch for any new signs of illness. Steroids can also potentially weaken the stomach's natural protective barrier, which is something to be mindful of, especially if NSAIDs are also being used, which is generally avoided.
Got it. The sources mentioned a couple of other drugs, too, for specific situations.
Right. Misoprostol is sometimes used particularly to help prevent or treat ulcers caused by NSA use.
Okay.
And for really tough immune-mediated cases that don't respond well to diet and steroids alone, sometimes stronger immunosuppressants are needed. Chlorambucil is one option, azathioprine is another, sometimes used in dogs, but it requires very careful monitoring due to potential bone marrow suppression, and it's generally avoided in cats because they're particularly sensitive to that side effect.
So, more heavy-duty options if needed, but with more monitoring. What about surgery for chronic gastritis itself? Is that common?
Surgery isn't usually the primary treatment for the inflammation itself, but it plays a role in specific situations. If there's a large granulomatous mass or severe hypertrophy causing an outflow obstruction, surgery might be needed to resolve the blockage, sometimes involving removing part of the stomach, partial gastrectomy.
Okay.
And as we mentioned, if a foreign object is stuck and can't be retrieved endoscopically, or if endoscopy isn't available, then a gastrotomy, surgically opening the stomach, would be done to remove it.
Right, for structural issues or failed endoscopy.
Yeah.
Okay, so once treatment is underway, what does follow-up look like? How do you monitor progress?
Monitoring is crucial. The main indicator of success is obviously resolution of the clinical signs, especially the vomiting.
Makes sense.
If there were electrolyte or acid-base abnormalities found on initial blood work, those should be rechecked to ensure they've normalized. For pets on those potentially myelosuppressive drugs like azathioprine or chlorambucil, regular CBCs are essential, maybe weekly at first, then spaced out to every 4-6 weeks to watch for drops in blood cell counts.
Okay.
Periodic chemistry profile monitoring, maybe every few months, might also be recommended depending on the case and medications used. If the signs decrease but don't fully resolve with treatment, or if they recur months or years later, repeating diagnostics, including endoscopy and biopsies, is often warranted.
Especially in cats, you mentioned.
Yes, particularly in cats, repeat biopsies are important if signs recur, as there's a known potential for inflammatory bowel disease to sometimes progress to small cell lymphoma over time.
Good to know. What about prevention? Anything owners can do to avoid this in the first place?
Well, some causes aren't preventable, like genetic predispositions or some immune issues, but owners can certainly minimize risks. Avoid using potentially irritating medications like NSAIDs or steroids unless absolutely necessary and prescribed by a vet.
Uh-huh.
Preventing free roaming and scavenging behavior helps avoid ingestion of toxins, foreign objects, and garbage. Basically, supervising what your pet eats and has access to.
Dietary discretion for the owner, too.
Exactly. And if a food allergy or intolerance is identified, strict avoidance of the offending ingredients is key for prevention of recurrence.
Okay. What are the main potential complications if chronic gastritis isn't managed well?
We've sort of touched on them, but the big ones include potential progression to more severe forms like atrophic gastritis, the development of gastric erosions or painful ulcers, that risk of aspiration pneumonia secondary to chronic vomiting, and significant electrolyte and acid-base disturbances from fluid losses.
Right. In the big picture, what's the expected course and prognosis generally?
It really, really varies depending on the underlying cause. That's the
So
key
what?
message. If a specific cause, like a foreign body, Helicobacter infection, or a dietary intolerance, can be identified and successfully treated or managed, the prognosis can actually be quite good to excellent. However, for idiopathic inflammatory bowel disease gastritis, or certain cancers, it might require long-term management, and the prognosis can be more guarded or variable.
So getting that diagnosis is paramount. It really seems the main takeaway here is that chronic vomiting, that ongoing, more than a few weeks kind of vomiting in dogs and cats, it's definitely not normal and shouldn't be ignored.
Absolutely not.
It signals that something is wrong. And because the list of possibilities is so incredibly long, a thorough investigation by a veterinarian is really essential to figure out the root cause and get the right treatment plan in place.
Precisely. If your pet is experiencing persistent vomiting like we've described, making that vet appointment is the most important step you can take.
Definitely. And that brings us to our final thought for you to chew on today. Given that huge, diverse list of potential causes we went through, I mean, everything from, something they might nibble in the garden to a medication they're taking to these complex internal immune reactions or even other underlying diseases, what seemingly every day, maybe innocuous things in your own pet's environment or routine might potentially be contributing to chronic gastric irritation without you even realizing it.
Yeah.
Maybe take a moment to observe your pets a bit more closely. Think about their daily habits, their diet, what they have access to. Could there be any hidden triggers? Something to think about. Thanks for taking this deep dive with us today.